Well, let's look closely at the situation in England. Dr. Esen Ukurabi is the GP registrar, Worcester Royal Hospital, and he joins us now virtually. Thank you for joining us on the program.
Thank you very much, Millicent.
All right. Many have looked forward to this year's holidays. I'm sure yourself as well, after so many plans were dashed last year as well. Give us a feel of what this year's Christmas looked like.
Well, I would say that there is a massive difference between where we are currently as a country and where we were last year. This time last year, families could not celebrate Christmas with themselves, and we were restricted from, meeting with loved ones and friends. This time last year, very few persons in England and in the United Kingdom were vaccinated. However, I think we are in a much better place at the moment if we look at the situation of things regarding the pandemic. This year, families could spend Christmas with themselves and with their loved ones. I had the privilege of spending Christmas with my family, my extended family and friends. This year, lots of people in the UK have also been vaccinated. There were no restrictions as far as England is concerned in terms of movements with coronavirus. And so Christmas was a lot better, of course, compared to last year. However, in places like Scotland and Wales, some restrictions came into play on Boxing Day. But in England, we're still as we were previously.
Now, the question is, with the surge that, England is experiencing in recent weeks due to the Omicron variant, do you expect there will be new measures, new restrictions to curtail the spread?
I mean, it is true that Omicron is spreading rather quickly, not just in England, but of course in the entire world. And just last week, England recorded a new highest level of infections per day. Over 120,000 persons were infected. But of course, studies over the world as well have been consistent in the fact that the Omicron variant causes less severe illness. And of course, the likelihood of being hospitalized is also reduced with the Omicron variant. As of today, the government have said that they have no intentions in England to introduce tougher restrictions. But of course, we can see the neighbors in Scotland and Wales, they have started to introduce some sort of restrictions. So nightclubs have been banned, large gatherings have been stopped. Social distancing have also been reinstated, as we saw earlier on in the pandemic. So I think if we continue to see the cases of the Omicron variants continue to rise, yes, it doesn't cause hospitalization, but some would be hospitalized. So if we have lots of infections, there might become a point where the government in England might introduce some restrictions in terms of movement in order to curb the spread.
We also understand that health workers, have been working hard. Immunization campaign went on Christmas Day in the race to inoculate as many people as possible. But we also hear that there is the consideration of door-to-door vaccination teams being deployed to prevent further restriction. Has this started?
Well, I have always said that vaccination still remains a vital aspect of battling this pandemic and the coronavirus. And you rightly said that the health workers, the GPs, those in hospitals have been working to ensure that vaccines are rolled out. At the moment, all adults in the UK and everyone over the age of 16 with a risk factor is entitled to have a booster dose. That's the third dose of the COVID vaccine, and measures have been ramped up to ensure that this happens. And of course, even on Christmas Day, where people were meant to be enjoying, there were still vaccination centers opened and offering booster doses and, of course, vaccines to people who have not yet received their vaccines. And in the nearest future, if there are still people yet to be vaccinated, we might see a situation where it will be a door-to-door vaccine program being instated in the United Kingdom. I think the drive is to make sure that as much as possible, a large number of the population gets vaccinated. This way, people will, of course, not fall ill, and of course, the pressure in hospital as well will be reduced.
Dr. Ersin Okore, BGP Registrar, Worcester Royal Hospital, England. Always a pleasure having you join us on the program. Thank you, and enjoy the rest of the holiday.
Thank you very much.